The following portion of Living Local DMV is sponsored by Metro Pain Spine Center. And welcome back. Pain can often stop us from doing the things we love, especially when it involves one of the most important parts of our body, our spine. But luckily, our friends at Metro Spine Pain Centers are here to diagnose that pain and help you get back to living life to its fullest. Joining us now for more is Metro Spine Pain Care Center's Medical Director, Dr. George Drakes. Thanks so much for joining us.
Welcome. Thank you for having me.
Of course, absolutely. So, is it right to call you a pain management specialist or pain management physician?
I think that's one of the appropriate terms that's used, but I believe pain control is one of them.
Gotcha.
And I like to believe that that embodies the fact that we try to not eliminate pain, but to bring it to a point where you remain functional.
Right. How did you get into this industry? Why did you want to focus your career on this specific area?
Interesting question. I actually started out after medical school to be a surgeon, but shortly realized that that was not my personality. It takes a certain personality. You have to be very person-oriented to be a pain doctor. You have to be empathetic and understand and have a brain to help diagnose and solve problems. It's a problem-solving kind of game. And I like to see pain management as a team sport. And as a team player, I think most physicians are team players, should be at least.
That makes sense. And then in terms of pain management, what kind of patients do you see? You know, who would qualify as a good patient for someone who's looking for pain management related to the spine?
There's not an ideal patient, but patients who present with pain, it works best for them, they're more successful at that pain journey by being participant in their care.
Right.
Not be passive, not come in and say, I'm here, now fix me.
An engaged patient.
An engaged patient, an invested patient. A patient who's willing to listen to good advice and to follow instruction, to be compliant with medication, with referrals for physical therapy, for all the things that you offer to him. Just be involved and see themselves as part of the team, as being the star of the team, so to speak.
I like that, the idea that it's kind of a team effort, including the patient. And then when people come in for chronic pain, would you say, is there a cure? Is it kind of management? What would you say?
That's an excellent question. Essentially, there's no pain cure. There are conditions, however, that are quite serious that can be reduced to a place where you have some control of the pain such that you are functional. At Metro Spine, our goal is to be the mechanism by which we get you to the point where your pain is at a point where you can function, function optimally, do the things you like to do. So to promise you to take all of your pain away is a fallacy. We're not going to do that. We're going to say, let's work together as a team, and let's get your pain to the point where you are able to do all the things that you enjoyed doing before you were sidelined by this pain.
Right, that makes total sense. I want to talk about spines a little bit. What would you say is the most common injury you see when people come in?
The back is certainly the lumbar spine. In order of frequency, it's going to be the lower back, the neck, and then the other segment of the spine, the thoracic spine. Spine, however, spine care takes several different types of specialists to participate in a concerted fashion to improve it. So the lumbar spine assessment may not actually end up being the cause of what you present with. So a person may present saying, I have back pain.
Right.
And my pain is going down my legs. Then you have to follow the symptoms, do a good physical exam along with a good history, and do the diagnostic test to arrive at how am I going to fix this particular problem. So back pain is not back pain is not back pain. It has to be assessed to determine exactly what you're going to do for that pain. And at Metro Spine, we do a very excellent job of doing that diagnostic approach.
That makes total sense, because I know back pain, it's complicated.
It's very complicated.
And thank you for doing what you do, because it's very important. And tell me a little bit about how people can contact you. If they want to make an appointment, where should they go?
Well, we have currently two offices want to be open next week. We are online. I think we have a social media specialist who have our information out, and there might be a QR code associated with this segment, in fact.
We do have a QR code that people can use to find out more information.
And then there's a phone number, 301-856-5860. I think that's the number. I hope I got it right, because I never use it myself.
That's okay. The QR code will do its job.
Absolutely. And we are on Facebook and all the other types of social media.
Fantastic. Well, Doctor, thank you so much. This was such an interesting conversation. I appreciate you doing what you do.
Thank you so much for having me.
Absolutely.
Yep.
Absolutely. And the preceding portion of Living Local DMV is sponsored by Metro Spine Pain Center.